We are gathered here to inaugurate Sampurnam Holistic Clinic and to bless Dr. Mankul Goyal with the hope of a huge success, realization of a vision which is very evident from everything that we know about you and everything you have just said. I hope that comes true. And oh, okay. Keep it close. All right. Um, I'm not much into public speaking. You can tell. It's not something that I do frequently. Um, so innovation is in the air, and innovation is the mood of the nation. And innovation is very welcome in healthcare delivery. We are a very unique nation where if there is a clearly positive facet, that is the freedom to practice medicine in this country. And you know this when you have practiced in UK, Canada, United States, Saudi Arabia, and you come back to India and you say, gee, I can do whatever I like. And now only responsible professionals, intelligent professionals will be able to exploit that freedom, that democracy. And I was very aware of it, and I made the most of it. So here is what I started with. I was born in Delhi. I went to medical school in Delhi, and I come back 20 years later, and nobody knows me in this city. And so I set about building a practice that I had visualized, uh, where it was about academic private practice, where not only you give your best professionalism to your patients, but you continue to upgrade that. You continue to grow, you continue to do better than what you are doing on a regular basis. And so there were a few things which were glaringly wrong in the Indian system. This is now 1988. I asked some of the doctors that I knew, why don't we work as a group practice? Oh no, it won't work in India because there is too much cash, and keeping track of cash is not practical and possible. So that's why we don't work together. We all work solo. So I said, well, I'll be damned. I'm going to fix that. And then I said, why don't you keep records? I saw nobody was keeping records. All they did was wrote a prescription and handed it to the patient, and the prescription was folded up and it sort of tore. So they said, well, if you will keep records, then you'll have to pay income tax. I said, I'll be damned. I want to be the first. I want to pay the income tax, so I'm going to keep records. Why don't you write the diagnosis on the prescription? Oh, then all the GPs will know what the diagnosis is and they will steal my patient. So that's a secret. So, I realized that I was in a system which was very inward looking, very stagnant, where practice of medicine was about making a living, generating an income, and it was about that. And so, so I then set about. Uh, I opened a small clinic in Aurobindo Place, shouting distance from here. And the next decision was what would be my consulting fee. And So at that time, the most eminent dermatologist in practice in Delhi was Dr. P.N. Behel. And he was my teacher, Mamsi, he was my mentor. And in a way, I was like a son to him. And so his fee was 64 rupees in 1988. I said, okay, my fee is 200 rupees. And I started with that. So the first thing was Dr. Dahal was very offended. He felt insulted that his student should have the gall to, ask for a fee so much more than him. He felt belittled, and I was very surprised by that reaction. And that sort of broke our relationship. And this is how narrow-minded, we were at that time. And so I carried on. So I kept records. I would ask the patient, who is your family doctor? I'll write a letter to the family doctor. Say, I saw your patient. You didn't refer, but I saw him. This is his problem, and this is my recommendation. So I did things like that until I got busy, and then I didn't have that much time to write letters. But so I followed my convictions. And how much time do I have? I came here to speak about integrated medicine. I have gotten on to something which is interesting. I want you to hear that. So, one of the things that I experienced was my patients would ask me, what hospital do I go to? And I would say none. I don't go to any hospital because there is no hospital good enough. After you have worked at the Cleveland Clinic, at the Edinburgh Hospital in Cambridge, how can you work in any of these hospitals? I wasn't ready. And so they will feel sorry for me. They will think that I wasn't good enough to get an attachment. So one day I said, okay, I'll join a hospital. So at that time, in my perception, Gangaram Hospital was the best private hospital. And so I asked for a visit to Dr. Sama, who was the chairman of Gangaram, if I could come and see the hospital. And he arranged that. I had a tour. I go to his office. I said, do you need a dermatologist? He said, when can you start? So I said, from the first of the month. So I worked there for 3 years. Then I went back to the chairman who had changed. That was Dr. K.P. Jain. And I said, how much notice do you need for me to resign? He says, no time, anytime you want, you can leave. So I said, okay, I'm giving you 3 months notice. I will be leaving in 3 months. So he said, fine. The word spread in the hospital that Raj Kubba is leaving Gangaram. Everybody would come up to me and say, we heard you're leaving. Why? So I would say, do you want short answer or the long answer? And they will be, embarrassed and awkward, and they'll say short answer now, long answer later. So I said, the short answer is that I no longer look forward to coming to this hospital, and I'm leaving. And they'll, stare at me like, what kind of a reason is that? Now, what I learned at Gangaram Hospital was 5% of Indians can afford what I have to offer. I was very highly trained, cutting edge clinical practice, and only 5% can afford that because that starts with a laboratory workup, which Dr. Dang will tell you is 25,000 rupees and up. That's the starting point, and then you spend time, you keep records, and so I said I'll concentrate on these 5% of patients, and that's what I have done. Fortunately for me, that 5% has grown to be 10%, and India is now on its way to becoming an affluent country. And I have enough patience to keep me busy. But I continue to learn. I continue to do better. In our clinic, we write on average 5 scientific papers every year that we publish internationally. And I was invited by Ames to give a talk on scope of research in private practice, and I gave a talk. And then uh, IADVL Delhi, our Delhi state branch, invited me to speak on academic private practice. They said, "You talk about, what is academic private practice?" And so I gave a talk, and I said, if you don't write a diagnosis on the prescription, you know, you are not doing academic private practice. If you don't keep records, you are not doing academic private practice, and so on. I told them a lot of things. So that's what we do. And so what I learned is that knowledge, wisdom must be passed on. It's a baton that you pass on to the next generation. And I'm simply doing that. I take on as many people as I can accommodate in my small clinic, and I share with them the essence of what I have learned, that I was fortunate to learn, and we continue to pursue excellence in our own way. And we diagnose the most difficult diseases, the rare diseases. We have uh, described new diseases. I personally have described a type of acne called insulin resistance acne, insulin resistance associated acne, and we continue to share with others everything that we have learned and we are learning. An important revelation, this is all very extempore that I'm speaking. When I came back, I would see patients and I would say, I've never seen a patient like this in all the countries where I have practiced. And in no time, I realized that the spectrum of skin disease in India was vastly different from skin diseases being seen and treated in other countries. And our books come from these countries. I was registrar to Dr. Arthur Rook, whose textbook of dermatology is read today as the Bible of dermatology, and I was his registrar for 3 years in Cambridge. And so I realized that what we have is not in the books. So we have to learn, and so we taught ourselves. So what did we learn? In our system of medicine, there are so many uh, different treatments, including self medications, alternative, medicine, that creates layers of a disease. And what we are looking at is the top layer of the disease, and we are trying to make a diagnosis and treat. So I learned to remove the layers and then come to the primary disease and then address that with the best possible scientific knowledge, evidence based, evidence informed, whatever is relevant is utilized. And so that's basically uh, you know, is in very brief a summary of my professional life and philosophy. I want to say a few more words of wisdom to Munkle. He already has, impressed me with his journey, and so I really see him as the future of dermatology, not only in Delhi but in India. So what I want to tell him is that the healthcare delivery system in India is a two-party system. There is no third party. There is no insurance. There is no government. It's directly between you and the patient. So between the two of you, you decide whether it's going to be a successful outcome or not. And the first thing that I learned very early in my practice, my patients had such a negative image of dermatology. They will tell me over and over again, but doctor, allopathy has no cure for skin disease. Aren't we wasting time? And so they were very reluctant to spend money on tests and doing things because they had no expectation. it We have changed that. Now it's the opposite. My patients come prepared to get a lot of tests done, and they appreciate that. And they have learned that it benefits them to know what their disease is, why it is. We use the word etiologic diagnosis constantly. And so in order to get the best result, you have to motivate the patient in a number of ways. You have to make them believe that you are the best doctor for their need, for their disease, for their clinical problem. You have to make them believe that you are giving them your best attention. You are not mechanically, working. You have to convince them with your body language, with your choice of words, etc. And an example that I do is I tell them that patients are like students. You can top the university, you can get 60%, you can fail. Same teacher, same class, such a array of results. So you have to decide: do you want to top? You want to really get cured? Then do everything that I say. Then I'm responsible. So there are things like that you learn from your patients to know what will affect them positively, modulate them to be compliant, adherent, which is a huge problem. And then we have a system of self-medication. Patients continue treatment then that you write for years on their own. Now I know that as an individual doctor I can't change that, but what I can do is I teach them enough about that medication that makes it less dangerous should they choose to self-medicate. And so there are these kind of things that you are constantly evolving. This is a never-ending thing. You are learning something every day. And so integrated medicine is an old idea. It's not a new idea, but its interpretation is extremely variable and is has to be very highly relevant to the needs of the patient population. And that's where the success or failure will lie. If I know you at all, I have no doubt you will succeed. And I will be around, hopefully, to then have an occasion, a celebration when you are felicitated and honored by all sorts of organizations. So, on behalf of Asha and me, the very best to you, Mankul. You can do it. You really can do it.